Tips to recover from blepharoplasty surgery. So in today's video, we will tell you everything you need to know so as to recover fully from your blepharoplasty surgery. Hello friends, I am Dr. Ankit Gupta and we do a lot of cases of blepharoplasty. And so today's video I am making on how you should prepare so that you recover really well from your blepharoplasty surgery, what things you need to take care of, how you would look, what medicines you would need, and how much time you would need from a blepharoplasty recovery so that you can plan well ahead before you go for your surgery. So number one, take time off. It is very important to take at least 5 days to 7 days off from whatever work you are doing. Keep your schedule clean because you will need this time to heal properly. You will need to assign your duties to someone else. You will have to find someone who can take care of you for at least initial 1 or 2 days and take care of your work for at least 5 to 7 days. Assign somebody at work so that you can take off for about a week from your work because you will be swollen. You will have bruises and you cannot go back to work for at least 5 to 7 days. Now, how to take self-care. So use these important tips. You need to use ice on your eyes. You need to use cold fermentation ice bags. You need to use cold fermentation in your eye area for about 2 to 3 days. Initial 2 to 3 days is very important. Do use ice fermentation as regularly as possible. I would recommend buy 2 ice packs specially for your eyes. Keep them in your freezer and you can use them alternatively for initial 2 days. Secondly, try to sleep upright. Keep your bed a bit elevated using 2 to 3 pillows, or if you have a bed that can be inclined so that the swelling can disappear or can go down much faster. Whenever you have to clean your eyelids very gently, do not over rub them, do not massage them. If you are used to wearing contact lenses, you have to avoid wearing contact lenses for at least 2 to 3 weeks after your surgery, especially if you have undergone transconjunctival blepharoplasty. You need to avoid wearing contact lenses for up to a month or so that the inside of your eyes can recover, and then only you need to wear your contact lenses. So for that you would need a spectacle. Very importantly, you are not allowed to smoke. Smoking inhibits your recovery process. Smoking delays healing. Try to avoid smoking or any kind of tobacco ingestion. During your initial 1 week, do not use blood thinners. Do not use multivitamins, green tea, fish oil, omega-3 fatty acid, or anything that can cause your blood thinning because that can cause bleeding inside your eyes. Third most important thing is to stay patient. You need to understand that the swelling, the bruising will take 7 to 10 days to go down, at least 7 days. So you need to stay patient and you have to aim for the end. You know the end will come, the end will be good, and you need to be patient for those 7 days. There's a possibility you might have a black eye, or there's a possibility there might be redness in the sclera, that is the white portion of your eye. There may be a lot of bruising in the lower area of your eyelid. That is all normal. That might take about a week to 10 days to disappear. You need to have patience and everything will be good. Fourth point, protect your eyes. You need to protect your eyes from the wind and the sun. So use dark colored big sunglasses to protect your eyes from the wind. You can also use sunscreen. Apply sunscreens every 3 hourly so as to protect your skin, the surrounding areas, from the sun. It is very important not to stress, not to strain, and not to pick up very heavy objects. If you stress or strain, your blood pressure rises, and if that happens, it might cause some amount of bleeding. So it is important to be relaxed and not to stress too much. Do not use screen too much. Use as minimal as possible for initial 1 week. To avoid stress, it is very important to sleep soundly. You need to take at least 7 to 8 hours of sleep for proper healing. You have to use all the medications that has been provided. You have to use your eye drops, your eye ointments, your medication that has been given to you so as you get a proper recovery. So these are the tips for proper recovery of your eyelid surgery. Do take care to do all your follow-up visits with your doctor so that he can also assess the proper recovery. If in case you have any issues with your surgery, if you have too much pain, if you have too much swelling, you should get back to your doctor as soon as possible so that they can assess you and they can guide you properly. Thank you very much.